All right. So Meg with Helping Hands Reentry, welcome. Thanks so much for being here.
Hi, everyone. Thanks for having me and thanks for having space for me to tell you a bit about what we do here at Bybee Lakes. And then I also want to leave space in case people have questions as well. So very broad strokes, bird's eye overview of what we do here at Bybee Lakes. So we are a transitional housing program. So people who are experiencing houselessness, homelessness, they can come live on site with us. The first step is kind of a 30-day shelter. And so they're able to stay with us up to 30 days. We have laundry on site, and like all meals are served on site. We have food accessible on site. And in those 30 days, we have our resource navigator work with them to make sure they're connected to food stamps, OHP, get them resources, supportive job coaching, whatever it kind of looks like. So we have that 30-day shelter. And then people can choose to, navigate to a program that meets their specific needs, or they're more than welcome to stay in our program, which is a transitional housing program. So the ultimate goal of our program is for people to transition into long-term independent housing. So we do that by essentially supporting them through our program. So they're attending classes. They at that point, it's not in the 30-day shelter, but at that point that they join the program, they start incurring a fee. It's $250 a month. That's to get people used to paying a bill, having them get financial responsibility. And then we can also be a rental referral for people who are getting housing as well. So there's also a volunteer service component to that as well. We expect people to give back to the community, whether it's on-site or off-site. So it starts with a 30-day shelter, hang out, figure out what your needs are. We'll help connect you to meeting those needs. And then either, support people navigating, maybe they're waiting for a family member to have a house, a room open up, or maybe they're waiting for a spot to open up in a treatment program. Or they're more than welcome to work our program, and we will help them, take the steps they need to become responsible and accountable for their needs, and then transition into their own place. So every person's, program looks different. So we meet people where they're at and do some needs assessments and try to help them get where they want to be. So that's, like I said, the very bird's eye overview of our program. And as Annie mentioned, we just received funding from the county. We've never been funded by the county. The county wanted to fund a lot of housing first models, and we have an expectation of sobriety. So if you're living on site, we do expect you to not be in active use, at least not be intoxicated on site. And we want to support people through that recovery process, but only about 50% of the people in our program identify as having some sort of drug or alcohol or even gambling, concerns. So, like I said, our program is meant to meet each person individually where they're at, for, a multitude of reasons, but that's the best way to support people, right? So, we just got that funding. So that feels really good. We're going to have ongoing conversations with the county to figure out what long-term sustainability looks like. So we did have to pause intakes, but we will be having those open up very soon. So if you're interested in learning about what it takes to become a referral partner, or if you want to know when we resume intakes, feel free to email me. I put my contact information in the chat. Feel free to reach out anytime. Even if you have other questions, I'm always happy to answer any questions. So speaking of questions, I want to open space. If anyone has any questions about Bybee Lakes or, anything kind of going up. Can asylees apply? I'm assuming that means people who are seeking asylum in America. Is that what that question means in the chat?
Yes.
So yes. So we are a referral-based program. So pretty much a community partner will advocate for a person, and will essentially, it's calling up a person or calling up our front desk and saying, hey, we have this person who we think would be a good fit for your program. And then after a conversation with our front desk, most people are able to come in. So we have had a lot of immigrants coming through, and some things that we kind of did to meet their needs. We started having ESL classes on site. We've built resources with community partners to help them navigate things, especially if they aren't, able to speak English. So we're willing to navigate and support whatever that looks like. I see some, Sherilyn, I'm sorry if I'm mispronouncing your name. I see your hand is raised.
Yes. Hi, Meg. Sherilyn from Milk Crate Kitchen. I don't think we've met in person, but I believe you know who my co-director is.
I know exactly. Yes. Nice to meet you.
You too. Thank you for that. And congratulations in securing funding, or hopefully it's secured funding from the county. It's amazing to me that Bybee Lakes in particular, as big as it is, has remained privately funded for as long as it has. Majority of that being through the first 2 years of the pandemic. So kudos, and I hope that the county sustains their support, because what you guys are doing is amazing. I understand what growing pains are. So that said, I have two questions. How long will the pause on the intake be? Is there already a targeted date on when you'll resume that? And how will you communicate that to your current referral partners? And then on the referral front, what type of referral network are you on? Like, I was recently approached by Connect Oregon, I believe is what it's called. So like more of like a systems question versus I know you're already, there are a lot of partners who are aware of your service, right? Like TPI, Blanche House, and the likes, everyone here. But are you on like specifically a referral network, like a systems software?
Sure. So, your second question was about like any kind of systems we use. So we're not really in a referral system per se. It's kind of mostly word of mouth. People reach out to us. Once a month, we host a referral partner training. The first half is about trauma-informed care. The second half is about details of our program. So that way you can communicate that to whomever you might be referring to our program. So there's a shared understanding of what it looks like to be here and what our program expectations are. So I wouldn't say it's so much of like a system that's like across the county, so much as, we collect information on people who attend the training. And if people opt in for emails, then we can put them into our mailing list. And that's how we'll be communicating about when we start to resume intake. So oftentimes we'll also post on the Hayden group, reach out to Annie so she can let everyone at CSN know. And so also if you're interested in joining that email list, feel free to reach out to me as well. And that'll probably be how we communicate that update, through email list, posting in various resource networks. If I have anyone's email, I will personally email some people as well. So when we resume intakes, I'm under the impression it should be this week. I'm not 100% on that. That is the impression that I have. Like I said, there will be a bunch of information going out. I also believe that there should be some sort of news article coming out, either the day before or a couple days before we start to resume intakes. So like I said, it should be this week. Don't quote me on that, even though this is recorded. But yeah, I'm hopeful it'll start soon.
Thank you, Meg.
Yeah, thank you. It's nice to someone meet you. I see a question in the chat. Are services for individuals only? Are services available for families as well? So yes, we do accept families. We have shelter for men with children, and we have shelter for women with children. The thing is, when people come in as a family unit, our dorms are gendered. We do also have a rainbow dorm as well for people who are non-binary, trans, want that safe space, identify in some sort of spectrum of the rainbow. So we do have that rainbow dorm. However, for family dorms, it's either men with children or women with children. So you come in as a family, and as much as possible, we have like spaces all over the building for families to interact. We have the daycare on site. We have a playground. We have tons of nature around us as well. And, but with the families though, so since they are gendered, it's not like if there's a male and a female coming in with a child, you know, the child could be with the male in the men and family dorm, or they'd be with the woman in the women's family dorm. However, we can't have both adults if they are opposite genders in the same space. And that's just how, you know, our, since it's congregate living, it's like everyone kind of sharing a mutual space, but then they have their own private space within that. So the families can all come in as a unit. I just like to be upfront that the parents aren't necessarily, you know, sharing the same living space. So yes, we can have participants engaged in a MAP program. We cannot accept methadone because once people are in the reentry program, we will do UAs, and methadone can oftentimes test positive for things other than methadone. So we do have Suboxone. And we do have we've partnered with Mind Solutions. Mind Solutions has counseling and SUD treatment and a MAP program that they offer on site. So if someone comes in and they're interested in starting a MAP program, we do have a resource on site for that. And there's generally no wait list. If someone is on a MAP program, we do need documentation. We need an ROI with their provider, and we need documentation. Also, that medication, a person can't just have it on them. It's kept in a lockbox in one of our staff offices, and we have staff 24/7. So no matter what time people can access their medication, it just can't be with them, like in their living space. It does have to remain in a lockbox in a staff office. So people have to provide that lockbox as well. So that way it's not our lockbox, it's their lockbox, it's their property. We don't want access to it. We just kind of keep it as a safe space. Any other questions about Bobby Lakes? I love this program. I love what we do. It feels really great to be a part of. And yes, highly recommend coming out for a tour. Love giving tours. I'm great at walking backwards. It's really fantastic. Yeah. It's a big building too, so you'll get your steps in. I promise you, you'll get your steps in. I think we're on 17 acres of land, and I think our building is like 150,000 square feet, something like that. So it's a big building. We have a lot of resources on site. We have counseling, we have a daycare, we have various medical services, such as chiropractic care. We have a optometrist come in, do vision exams, and help people get free glasses. You know, we just want to bring the mountain to Muhammad as much as possible. So
I love it. That's awesome. Okay, so Sherilyn, I see your question. Is it a quick one? We just have about 1 minute left. Sorry, I don't mean to rush you. Go ahead if you'd like to share, if you'd like to ask.
you're muted. Yeah.
Yeah, does Bybee have other plans that they can share as far as sustaining your own operations through other funding source besides the county? Because I'm thinking about your current participants who may have exited when they heard the news that you might be closing.
So that is not a me question. I don't handle the funding and sources like that. I imagine that that information will come to light over the course of the next few months as we continue to work with the county, because that's something that the county has also asked. So like I said, feel free to reach out, you know, if those articles coming out aren't answering that question for you. And I can absolutely connect you with the person who can answer that, or I could, you know, find that answer out for you. You know, my phone number, you can call or text, you can email me anytime. I'll repost my information in the chat before I head out, because I do have another meeting to get to at 10. So yeah, there should be information coming out about that.
Awesome. Thank you everyone for the questions, and thanks Meg for the awesome information and for doing the work that you do. I'm super excited for you and your program, definitely for the funding for sure. As we know, that's always a challenge. So kudos. All right. And just send me the information when you have it as far as registration intake. Great. Thank you. Okay. Awesome. Next up, we have Rosemary Schmidt with Multnomah County Aging, Disability, and Veterans Services. All right. Thanks for being here, Rosemary.
Oh, thanks for having me, Annie. Good morning, everyone. My name is Rosemary. I use she, her pronouns, and I'm an outreach coordinator with Multnomah County's Aging, Disability, and Veterans Services Division, or ADVSD for short. But all of the programs that I'm going to tell you about today are available statewide. So if you're tuning in from outside of Multnomah County, these programs are available to you as well. And if you'll bear with me 1 second, I'm going to share my screen with you. All right, can everybody see my presentation? Great. Okay, and so today I'm going to talk about SHIBA and the basics of Medicare and Oregon Medicare Savings Connect. I'm also going to talk about the parts of Medicare and the Medicare open enrollment period because that's coming up in October. And I'll briefly mention Senior Medicare Patrol and the ADRC. All right, so first of all, what is SHIBA? SHIBA stands for Senior Health Insurance Benefits Assistance. This is a program that provides individual Medicare counseling and advocacy by certified counselors. It's a free service of the state of Oregon, and it works in partnership with local sponsors. So there are SHIBA programs in different counties throughout the state of Oregon. And this program has been around since about 1980. It's funded by the federal government to help people understand the Medicare program. And if they have problems with Medicare, then they also have really strong advocates to help them out. And the program depends on highly trained volunteer counselors with an in-depth knowledge of Medicare. The counselors complete a very extensive Medicare training and they become certified to counsel people. They really are Medicare subject matter experts. And the counseling is free and unbiased. There are no income requirements for SHIBA counseling. It's available to anyone who has Medicare. And the SHIBA counselors do not represent or promote particular plans. They aim to be as neutral as possible. And they can provide information and help people compare their health and drug plan options. However, the decision of what plan to choose is always up to the individual. And by comparing their Medicare plan options, SHIBA counselors can help Medicare beneficiaries choose the best plan for them at the most affordable price. And the counselors can also assist with Medicare appeals and filing formal Medicare complaints. And they're available to meet one-on-one, virtually, over the phone, and in person. They're starting to resume some in-person appointments. And this is the Oregon SHIBA website. There is a link to the 2023 Oregon Medicare Guide. And the 2024 guide will be posted around October 15th in time for open enrollment. There's a link where someone can find their local SHIBA office. And there are a lot of free Medicare classes and events that are posted, and many of these are offered virtually. So if you're interested in a deeper dive into Medicare, because I'm just going to touch upon the basics today, I encourage you to go on this website and maybe sign up for one of the webinars, and they're all free and available to anyone. This is the Multnomah County SHIBA website. It's got a lot of useful information, and we will be posting links to our Medicare open enrollment flyers soon, and these will be available in a few different languages. Okay, so what is Medicare? Medicare is the federal health insurance program for people who are 65 and older, who are under 65 and on disability for 2 years, and for people with end-stage renal disease and ALS. So people with these two diseases receive a fast track onto Medicare. And they don't have to wait the 2 years that other people on disability have to wait. And lawful permanent residents with 5 continuous qualifying years of U.S. residency are eligible for Medicare as well, as long as they meet one of the other requirements above. And Medicare eligibility is not based on income, and it's not based on work history. Work history will affect Medicare costs, but it does not affect Medicare eligibility. And there are 10 to 11,000 people per day turning 65 in the United States and becoming eligible for Medicare. So the SHIBA program stays pretty busy all year round. And in order to start Medicare, you have to go through Social Security. They are keeping track of how much someone has earned working, and also how many work credits they have earned. And they do not have any info on actual Medicare benefits. Their job is just to determine if someone is eligible and when their Medicare coverage will start. And once someone is in the program, Medicare benefits are administered by CMS. All right, and I'm just going to talk about the very basic parts of Medicare today in the interest of time. And Medicare is broken up into 4 main parts. So Part A is hospital insurance. This is usually premium free as long as someone has 40 credits of work history, which can be earned in about 10 years of work. And Part A comes with your Social Security retirement benefits, but Parts B, C, and D are all add-ons. So Part B is optional, and it's medical insurance. It has a monthly premium, and there are penalties that will be applied if someone delays enrollment in Part B. So if they don't sign up when they're first eligible, they can have a financial penalty that will follow them through the rest of their time on Medicare. And Part C is optional with Parts A and B. This is privatized managed care. And these plans are geographically specific, and they offer all of the same benefits as A and B, but they can offer some additional benefits that Parts A and B do not offer, such as dental, hearing, and vision care, and maybe some alternative health benefits and silver sneakers, gym memberships. But there may be an additional premium along with these additional benefits. Oops. And Part D is prescription drug coverage, and it's optional with Parts A or B, and the plans are state specific. There are a lot of choices and the premiums vary. And like with Part B, penalties do apply for delayed enrollment. So if you don't enroll in Part D plan when you're first eligible, you can have a financial penalty that will stay with you. And if someone wants Parts B, C, or D, they do need to take an action to enroll in those. Okay, and Medicare enrollment, it's automatic if someone's already collecting their Social Security benefits or Railroad Retirement Board benefits. It's automatic if you have been receiving disability for 24 months and if you've been receiving disability because of ALS. You must actively sign up if you are turning 65 and do not receive Social Security benefits. So if you're delaying collecting your Social Security benefits but are turning 65, you will need to be sure to reach out to Social Security to sign up. And it's advised any conversations you have with Social Security that you document those. If you ever need to file an appeal, it's really great to have that documentation. Okay, and people with Medicare should consider their healthcare needs carefully every year, and remember that there are only certain times each year when they can make changes to their coverage. And there are a lot of different enrollment periods. I'll just talk about 3 important ones today. The initial enrollment period is the 7-month period surrounding someone's 65th birthday. So, and that's 3 months before, the month during their birthday, and 3 months after. If they miss their initial enrollment period, they must wait until the general enrollment period, which is January 1st to March 31st. And then I also wanted to talk about the fall open enrollment period because it's really important and it's coming up. It starts October 15th and it ends December 7th. And during this enrollment period, people with Medicare have the opportunity to make changes to their Medicare Advantage plan, their Part D drug plan, or they can choose to enroll in a Medicare Advantage plan or return to original Medicare, which is Part A and Part B. And Medicare health and drug insurance plans, they change their costs and their offerings every year. And a person's individual health needs can change each year as well. So now is the time for people to review their coverage options and make a choice that best meets their needs. And the Sheba program can help with that. So they're providing free one-on-one counseling during open enrollment. The appointments will be in person, over the phone, and virtually. And people just need to register in advance for those sessions. And I will show the phone number to make an appointment a little later on another slide. Okay, and Oregon Medicare Savings Connect is a program that is available to help with some of these Medicare costs. It's federally funded, statewide program that is housed at Multnomah County. The goal is to get people of a limited income who have Medicare to enroll in these Medicare cost savings program. And there's extra focus on outreach to marginalized communities. So the program provides information and enrollment for MSP and extra help. And MSP helps with Part B premium costs. The current premium is about $165 per month. And there are no income or resource limits. So Oregon eliminated those a few years ago. There's a few different ways to apply for MSP. They can contact OMSC for help. They can contact their local branch office directly. They can also contact the ADRC and get information and assistance as well. So there's really no wrong door. And extra help helps with the Part D prescription drug costs. It reduces the monthly premium to $0, cuts the yearly deductible to $0, reduces pharmacy copays, and it eliminates the coverage gap. And also, if someone has a Part D late enrollment penalty, getting onto extra help will eliminate that late enrollment penalty for that person. And this program can help save an estimated $5,300 per year. The level of assistance depends on income and resources, and the income and resource limits change every year in March. So some different ways to apply, but if you contact OMSC, my colleague Zakia will screen the person, see if they're eligible, and can complete the application for them over the phone and submit it directly to Social Security. And we have access to a language line, so we can help people regardless of language. And you can also apply directly through Social Security. And we have a website with more information and flyers available in many different languages. And it's helpful to check our website every year in March because we'll post the new income and resource limits and our updated flyers with that information. Yeah, I think I might be just about out of time. So I won't talk too much about the Medicare fraud, but I'll just show the ADRC helpline phone number. You can contact the ADRC for scheduling Sheba appointments and Sheba open enrollment appointments. You can also contact the ADRC to get any information or resources for an older adult or a person with a disability or a veteran. There's the Multnomah County ADRC and the statewide ADRC, as well as a searchable database. So it's a really great first door to getting connected to all the resources that are available. And it's not just resources that Multnomah County offers, but resources that community partners offer as well. So I will stop there and I'm happy to share the slides after this meeting. Yeah.
Awesome. Thank you so much,
Yeah.
Rosemary. This information is so timely and important right now, especially as we move into open enrollment. Thank you so much for sharing that. And it looks like you have one quick question in the chat that if we could just take a 1 minute or so to answer. How would clients know whether they are enrolled in extra help?
How they would know. Well, a great way to find out would just to contact the Oregon Medicare Savings Connect program. Zakia can look up that information for the person, or you can also reach out to the Social Security Administration to see if you are enrolled.
Awesome.
And you would also know by when you visit the pharmacy, how much you're being charged for prescriptions, but I think the easiest way to find out would be to contact the OMSC or Social Security Administration.
Awesome. Thank you so much. And Rosemary, I know you did earlier, but would you mind putting your contact information in the chat for folks to be able to connect with you with any follow-up questions?
Sure. Yeah. And thank you so
Awesome.
much.
Thank you so much. And thank you so much for all that you do. All right. So next we have Georgianne Pierce with Providence ElderPlace. Thank you so much, Georgianne, for being here. We appreciate you.
Thank you, everyone. Thank you. My name is Georgianne Pierce. I'm from Providence ElderPlace, and I've been with Providence for about a year, and I bring information to the community as an outreach coordinator about PACE. So give me a moment and I'll share my screen and we'll get started. Okay. Are you able to see my screen? Okay. Can you hear me? All righty. All right. Welcome and get to know PACE. Providence ElderPlace is a program for all-inclusive care for the elderly, PACE. This information is given to the webinar is adequate to the date of this presentation. If you have any updates, then you can contact our office. So what I'm going to do today is tell you what PACE is about, who is eligible, and first step to service. I'm going to start off and give you a little 2-minute video about what PACE does.
Lisa works full-time and cares.
I think we lost the audio.
For her aging mom.
Oh, okay.
Her days were spent doing housework, helping mom with personal care, making appointments, arranging in-home help, managing medications, running errands, and driving mom to all her appointments. Lisa was exhausted and overwhelmed, and she worried about how to pay for mom's increasing care needs. Then Lisa discovered Providence ElderPlace PACE, a program of all-inclusive care for the elderly. Providence ElderPlace PACE meets mom's needs all under one roof. With ElderPlace PACE, she has a care team of professionals. They work together to coordinate and deliver mom's health and care needs. Her team includes her primary care provider, nurse, social worker, chaplain, dietitian, caregiver, dentist, rehab therapist, life enrichment coordinator, transportation driver, and pharmacist. Mom's team makes sure she has the care, medical supplies, medications, equipment, and social enrichment she needs for overall well-being. Lisa met with a Providence ElderPlace PACE enrollment specialist. She learned that the program is both health insurance and healthcare provider combined. Mom qualifies because of her age and she lives in the service area. She needs help with mobility and toileting, can live safely in the community, such as her own home or in assisted living, and she agrees to receive her health and personal care from Providence ElderPlace PACE. Best of all, ElderPlace PACE accepts both private pay and Medicaid. Lisa doesn't have to worry about how to pay for mom's care as it increases. Now Lisa can relax and enjoy her time with mom. The Providence ElderPlace PACE care team handles all the details. Is Providence ElderPlace PACE right for your family? Find out. Call today.
According to the West Health Foundation, participants have a better health outcome and lower costs than elder with acuity or level of need who are not enrolled in a PACE program. Participants are also more likely to live longer, have fewer unmet needs, and enjoy a higher quality of life. We just had a participant who just passed away, who was in PACE for 40 years. The person was 96 years old. Let's see here. PACE, what is PACE about? The program has demonstrated that it reduces rates of emergency room visits, unnecessary hospital admission, and long-term nursing home placements. And according to the National PACE Association, over 90% of current participants successfully remain in their homes and community and care. ElderPlace is both a health insurance and medical provider. So when a person becomes a participant of PACE, then PACE becomes that a medical provider, just like a person would if they were covered through Kaiser. All the providers are through PACE. PACE provides a unique approach to care for the older adults with chronic health conditions. Let me see. Our goals are simple. We provide early interventions, and we also avoid hospitalization and nursing home, stabilization of the senior, and we listen to a senior goals for their care for the whole person. And we call our members participants because they participate in their care, and their caregivers. Our interdisciplinary team, normally when you go to the doctor, you have the primary care physician and the registered nurse, but all of the interdisciplinary team is on site. We have primary care doctor, the registered nurse, social worker, activity coordinator, dietitian, physical therapist, mental health provider, a pharmacist, home care coordinator, and we have our own bus and van drivers. We have our own occupational therapist, chaplain, personal care aide, and we have a day center manager. And all these are on at all of our sites. So when a person becomes a participant of PACE, there's no out-of-pocket for anything. There's no co-payment, no out-of-pocket for deductible, primary care, primary Medicare, zero, specialty medical care, zero. We provide dental, vision, hearing, foot care, zero out-of-pocket, coordinating care, and customized care planning. Medication and medical supplies and equipment are zero, and we also, there's no cost for over-the-counter medication as well. In-home care, home health care, we have supportive housing. Now, we don't actually supply the housing, but we support in housing, like we have assisted living and residential care that we contract with. We have a daycare, which is what you would call a senior center with on-site caregivers. So we have a social center for folks to come for activities and social support. We have physical, occupational, and speech therapy, hospitalization and medical procedures, no out-of-pocket. That's for inpatient or outpatient care. Transportation provided by PACE driver. They'll pick our participant up from wherever they're at, from their homes or wherever they're at, and bring them into the PACE center. Emergency and urgent care, no cost to the member. If you look at PACE versus traditional health care, what PACE care coordinated by PACE, this is what our healthcare is coordinated by PACE. We make the PCP and specialty appointments. We provide and schedule transportation. We gather specialty and auxiliary care appointment results and merge them with primary care and track whole person care. We order and deliver medication, equipment, incontinence, and other supplies. The medication is reviewed by a PACE pharmacist. PACE schedule transportation to the dental, vision, hearing, mental health, and foot care. schedule and pay for in-home caregiver. We arrange and pay for high level of care when needed, assisted living or memory care. So when a person is part of PACE, if they need a higher level of care, PACE pays for that additional care. There's no cost to our member, and like I said, they just go on to whatever care they need, assisted living or memory care. Clinical care plan is reviewed every 6 months. So our clients their care plans reviewed every 6 months. Update care plan received at your PACE clinic or from a PACE home visit. So we even visit our participants at home if they're not able to come into the clinic. The care plan is made by the PACE care team. It is tailor-made, participant direct plan, which identifies what is most important to the participant medically, socially, and cognitively. This is a whole person overview of your care through PACE. What's awesome is that PACE provide high quality outcomes. We have less than 1 ER visit per year. We reduce hospitalization at 24% lower hospitalization rate than dually eligible beneficiary who receive Medicaid nursing home services. We also decrease rehospitalization by 16% less than the national rehospitalization rate of 22.9% for dually eligible beneficiary who are 65 and older. So there was some data done for PACE of Oregon 2020 for hospitalization. So for dually eligible, PACE is reduced almost by 0.5% versus we were 11.92 versus 23%, less than 0.5% hospitalization. And so a lot of times we hear people ask, why haven't I heard about PACE? Is this new? And what's really cool, we have the privilege of saying that the PACE program has been caring for seniors for over 30 years. Case for early referrals. So the key is prevention is the key. So all care appointments, behavior, health, specialty, transportation, equipment, and supplies, and housing coordination at one location. We have stabilization before a crisis. So all the coordination is done at one of the PACE, wherever the participant where they live is where they get their care in one location. A lot of times when a person, when you're in a crisis, what happens is finding care in a crisis can be challenging. Sometimes Medicaid screening and assessment takes between maybe 30 to 60 days. And also PACE enrollment cannot enroll while a person's in a hospital or nursing home, and then finding housing or in-home care in a crisis. Housing, when a person becomes part of PACE, housing stabilization happens. Our team follow the participant where they live, and we have all eyes on our participants. For example, let's say that the PACE driver will pick up one of the participants to come into the clinic and notice that, you know, the person's not quite the same or there's something different. That is immediately communicated to the team, and the team can immediately find out what's going on and be proactive. So we have a lot of eyes on our member. Once a senior is in PACE, the senior family is not responsible to make appointments, schedule transportation, or order supplies. So PACE takes care of all that. We have more wraparound support for a client with mental health needs. All concerns and needs go to one location. If it's mental health, specialty housing, or any change of condition, we have one location that participant will go to for services. So it'll be all in one location. So who is eligible for PACE? Age 55 or older, able to live in the community setting, own home, assisted living, memory care, adult care home, and in need of assistance care in mobility, toiletry, or cognition. And that's those, they have to have at least two help assistant, where they need assistant with, if they need assistant with mobility, where someone's, you need to help them out of a chair, or if they're falling a lot, and if you need to come in and help them with their toiletry needs, like if you need to help clean up after them, and if a person's with their cognition, if they're forgetting to their appointments, are confused, not able to do daily activity, those are some of the things that come into view for that. And the income for Medicaid, you can't make over 2,725. But if it's over that, a case manager can, you can talk to them about setting up a trust fund. And the assets and saving no more than $2,000. And you have to be Medicaid eligible or willing to pay privately. And also you have to live in our service area. Now, Multnomah County is 100% of Multnomah County, and then parts of Clackamas and Washington County and North Coast. Where do seniors on PACE live? In their own home, assisted living, memory care, adult care home, and we contract with 500 plus facilities. And please, you can contact me, Georgianne, at providence.org, or you can 503-519-2483. How to get started, you can call 503-215-6556, or you can email me, email ElderPlace info@Providence. And if not on Medicaid, we will guide you to get started. Thank you, everyone, so much. Oh, I think I went 3 minutes over my time. I'm sorry. Let's see.
That is okay. That's okay. It looks like Tori answered the question from Judy. So this program, every time I see this presentation or variation of it, it always amazes me at the support that's being offered, having elder parents and knowing the amount of time that goes into organizing, you know, all the medical appointments and medications and
Right.
driving and all of that for when my mom was doing all that for my dad. It was a lot. So super beneficial program. Thank you so much, Georgianne, for sharing and for the work that you do. I don't want to cut you off, but we want to just make sure we have time for everyone else. So
Okay.
if you have, if you could just put your email directly in the chat, that would be fantastic, Georgianne. And then if you're okay sharing this with me afterward, I can send it out.
Definitely.
And then anyone can direct their questions directly to Georgianne after this.
Thank you so much.
Thank you very much for being here. We appreciate you and the information you shared. All right. Next up, we have Northwest Pilot Project, and we have Jason Colthurst with Northwest Pilot Project.
Hi, so my name is
Oh,
Lila Peterman. Hi, and I'm
hi.
here with the Northwest Pilot Project. Jason, unfortunately, is out today, and so apologies on my end for not having a PowerPoint or anything very formal prepared. I'm just going to wing it.
No problem. Go for it.
Perfect. Yeah, so I'm here with the Northwest Pilot Project, and I am the Permanent Supportive Housing Supervisor. And so I'll just start off talking about how to qualify for services. Now, to qualify for services at the pilot project in general, one needs to be 55 or older, low income, homeless, or at risk of homelessness. And to access services, you would typically start by calling the front desk, leaving a message. We don't answer the phones live. We don't have capacity to do that due to getting upwards of 100 calls a week. And someone calls you back in a few days. In theory, it's only a couple of days. Sometimes it does take a little bit longer. And then once that happens, you connect with someone on the access team. That's the team Jason supervises. And you just have a conversation with whoever's calling you, an assessment of sorts. and we go from there depending on what your needs are. And so at the pilot project, we have the access team. They provide rental assistance directly to people who qualify. They refer people to more traditional housing case management. Then we have our regular housing case management team that helps people who are homeless and low income address any barriers to housing, with the long-term goal being, permanent affordable housing. And for a lot of people, that means subsidized housing for the vast majority. We also have a retention team. And so with regular housing case management, typically people kind of graduate at one point. Once they're in housing, which can be a long road, once they're in that long-term affordable housing, after people have been stable in that for a while, they'll kind of get exited from case management. But some people still need a little extra help for the long term. And sometimes that's just cleaning. A lot of times it's cleaning. It might be, rides places because they have some serious mobility issues. But that's what our retention team does. We have several buildings we have partnerships with downtown. So they go to those buildings regularly and help the folks that live there. And I would say they're very, very, very busy. There's no shortage of things for them to be doing. A lot of people really benefit from those ongoing supports. And then we have the PSH team. That's the supportive housing team, the team I supervise. And we're kind of siloed from the rest of the agency in a sense. So for people to qualify for PSH, you need to have a coordinated access to care assessment done. And if anyone has questions, I'd be happy to talk more about that. But then you get a score with a VSPDAT and this coordinated access assessment. It's all kind of run through the county and the joint office, and they send us the referrals. So we don't have any say, in who ends up getting these services. Right now we have two kind of programs within PSH. One is scattered site. And that's one of the best things about PSH is there's always a subsidy attached, whether it's whether it's a building that's subsidized, people are moving into, or a voucher. You always have that part taken care of, which is really makes our lives a lot easier and their lives a lot easier. But right now we have a building called ElderPlace that we provide services to. We have 48 households in that building and 3 case managers that work on sites there and here. And then we also have our scattered site project. And we have 3 case managers that work with folks all throughout Multnomah County. And there's benefits to both having the voucher, which is what everyone really wants, because then they can decide where they're going to live. There's also benefits to a building like ElderPlace, where people really have a sense of community. And so, yeah, those are kind of the different things we do. And then I'm going to add something to the chat here. So people call us, like I said, for rental assistance because they need help finding housing. So we've developed this tool that's now in the chat. And so this is great for people who don't have any cognitive concerns, but you can go onto our website, complete this assessment, and it'll kind of generate the right lists of different types of housing that you might qualify for, and sometimes give you some next step information. Like if you answer yes, you've had an eviction, it'll maybe tell you information about how to address that, criminal history, things of that nature. And so we've gotten a lot of feedback on this tool and people have found it really helpful. And then people don't have to wait for that call back unless they have, a lot of barriers to housing, cognitive concerns, they need that extra support. So that's kind of it in a nutshell. That was only 5 minutes, but I'd be happy to answer questions if anyone has any.
Any questions? Okay, awesome.
Okay.
If you wouldn't mind putting your information in the chat for follow-up questions in case any pop up, that would be fantastic. Leila, thank you so much. Or Lila, I'm sorry. Thank you so much for sharing today and for being here and for stepping in for Jason. Appreciate that very much. And
Thank
for
you.
the work you do. All right. Okay. So next up, we have Chris Fellini and Judy Lee from the Community for Positive Aging. And I apologize earlier. I did not include Judy in the announcements. So my apologies, Judy. Thank you so much for being here.
No worries. Thank you very much for the introduction, Annie. My name is Judy Lee. I'm the Director of Operations for Community for Positive Aging. And along with me are Chris Fellini, who is our Community Health Director, and our colleague Riley Thayer, who is one of our amazing community health navigators who actually told us about this network and asked us to come. It's great to see some familiar faces from our work in the past with Sherilyn and Martha. Great to see you and to meet some new friends. So I'm going to share my screen and talk a little bit about our work at Community for Positive Aging. And unfortunately, I'm working off one screen, so Riley's going to help me monitor the chats and see if there are any questions. So if I may go ahead and share my screen. Can everyone see this okay? Great. So the Community for Positive Aging, although it's a relatively new name, it's actually a merge of the former Hollywood Senior Center and the Giving Tree. So we are celebrating our 50th anniversary and just had our benefit concert last Friday night with Thomas Lauderdale and China Forbes of the Pink Martinis, along with the Hollywood Ukulele Group and the Grant High School Royal Blues. So it was a really fun celebration. And what we focus on, if you will, is really as a space for adults 55 and over to receive support and connect with each other in the Hollywood neighborhood. We merged with the Giving Tree in 2021, which was another nonprofit, worked a lot with Northwest Pilot Projects and other folks in downtown area that provide life enrichment and resident service coordination in the downtown core, if you will, with low-income housing. So the two organizations merged in 2021 because we saw a lot of similarities in serving these vulnerable communities. Specifically, they have challenges with accessing technology, they have language barriers, readability, and many times that we find programming that's applicable to both, if you will, sides of the organization. So in that way, that's what led us to be together. Our mission is really to foster a healthier, inclusive, and connected Portland, and that we believe very strongly in intergenerational service, in being age positive and age inclusive. I think sometimes, especially in the Western culture, we tend to think of aging as this sad phase sometimes, or something that's not as celebrated as many other cultures around the world. So we want to help change that, in that, aging should be a thriving phase of anyone's life. And that there are many intergenerational and wisdoms that we can glean from our older adults. So with all of that said, I'm going to introduce and talk about our three different core pillars of the services that we offer. I will pause and talk a little bit more about the services that are currently open, because I think that will be beneficial to the group. Some of our services, unfortunately, have restrictions, whether or not be age or income or geographical. So that's what we're going to focus on. So we have our three core pillars, which are community services, community health, and community connection. So starting with community services, we are a district center for Multnomah County Aging Disability Services. So what that means is we provide information assistance. So let's say if you are working with seniors and they may have a question about food access in their area, or housing assistance, or where they can go to sign up for insurance, they can call information assistance, and we have a specialist that will walk them through the steps in doing so and give them referrals. We also offer the traditional case management and caregiver support through Multnomah County and other state and federal grants as well. One of the programs we do have open is transportation. So what that means is if you have a client who may be needing transportation assistance in terms of providing subsidized TriMet passes, or that they might need lift, as in not the LYFT, but the LIFT program. We have currently openings in both of those programs, and the eligibility are a little bit different. So they both have income and disability, along with other factors that we have to look at for eligibility. Lastly, as part of our community services, and this is where we work a lot with Sherry Lynn's group as well, is food security. So we have 4 different food security programs, but the 2 that are currently open are known as the Tuesday Gleaning, where we take goods from 99 Ranch, so it's a culturally specific Asian grocery store out on the west side, as well as New Seasons. And we also work with the Portland Food Street Project, especially during the summertime, to provide food to the community. And that is on a, you come, there's no eligibility criteria. It's every Tuesday at 1:30. And it's done whenever the food's all gone. So definitely you come in, you will get a color ticket with a number, and the volunteer do a fantastic job rotating through everybody. So everyone will get a chance to go at least 1 round. And then depending on the food remaining, folks will get to go a 2nd or a 3rd round. So the items really vary because it is a gleaning program. And the other program we have that has opening right now is the Neighborhood Gleaners, which is a program that takes gleaned produce from the Hollywood Farmers Market on Saturdays and deliver them to individual households. And the volunteers in that program do a fantastic job, try to be as specific and tailored as possible. So for example, if you put on the application, you don't want kale, they will do everything they can not to give you kale. So both have current openings at the moment, along with our transportation program. The next pillar we offer is our community health program, and that's the team that both Chris and Riley are on. So through our grant with the National Council on Aging, we will be offering, so we've been doing vaccine clinic work for the last 2 years. And thanks to this grant, we will continue to do vaccine clinics this year. And I know we're one of the few agencies to do so. So we will make sure every month when we come back to this space, we will be sharing our upcoming vaccine clinics. Because I know they're going to be a little bit challenging to find. I think the most of the time in this coming year, you're going to be finding a lot of pharmacies doing giving vaccines, as well as some county efforts in terms of federal qualified clinics. But even many of the counties we've spoken to are having a hard time because the funding's not there. So we're happy to share our vaccine clinic. And in our clinic, the first one will be Thursday, October 19th, from 10 a.m. to noon at our Hollywood Center office. We will be offering the new COVID shot, flu shot, as well as RSV. And we'll provide all that information to Annie later on when we have confirmed the details, so we can be shared out to the partners. Another thing we do in the community health is resource fairs. So I know many of you probably have seen familiar faces of Riley at your resource fairs or attending the resource fairs with you. We really want to share our information, what we do at the center, but just generally providing information to our community. We're very fortunate that we have bilingual staff in our organization. So we do have staff that speak Chinese Mandarin, Russian, Belarusian, and Spanish on our teams. So at times we're able to translate some of the materials directly, whereas some partners may have challenge or takes longer to do so. In addition, we have produced a series of health information videos that, for example, it ranges from how to cope with loneliness, especially very critical for seniors, as well as how to prevent falls for seniors. Sherry Lynn collaborated with us on a project about food security in the Portland area. We will have information coming up, particularly for those in low-income housing, on how to pass housing inspections, because we know that's a topic that weighs heavily for some folks. We also provide enhanced resident service coordination. So we are in 6 low-income buildings. Along with one of the building, we provide permanent supportive housing services. So we do everything from life enrichment, art activities, to pop-up food pantries, to mental health service coordination, or just how to sign up for OHP and SNAP benefits, so long-term safety nets as well. Then lastly, we have the community connection. And this is probably more what you think of a traditional senior center. Many of our programs are in person as well as hybrid, and we have some that are actually just online also. So the idea behind these programs is really to provide information to our senior population, as well as our low-income housing folks, but also to reduce their social isolation. So they range from fitness activity to evidence-based classes, social programs, peer support groups, and of course, it's a great way for also community members to volunteer. And we're always looking for volunteers. So we will provide our information at the very last slide. And if you'd like to come volunteer, or if a community group want to come and present, we very much welcome that. For several of our food pantry programs, we actually have a monthly partner spotlight where they come and talk about their program and provide information to the seniors. So for any of these programs, the best way is really to call our main line, which is 503-288-8303. And we'll share the slides with Annie so she can send them out afterwards. Or go on our website. I will say it is under construction at the moment. So there are parts of it that may not be as updated. And of course, I provided Riley's email just because she's probably the most responsive, I would say, or the fastest response out of us. So definitely encourage you to connect with her. Are there any questions anyone has? Okay. If there are no more questions, I'm going to turn it back to Annie then.
Awesome. Thank you, Judy, so much. I appreciate you and your team. Thank you so much, Christopher and Riley, for being here and presenting this information today, and for all the work that you do at the resource fairs and in community. So super awesome. All right. So looks like Riley's email is in the chat. So if you have any follow-up questions, please feel free to reach out to Riley, and we will continue along. So we have, let's see, that is all of our presenters today. I just wanted to make sure I had everyone that, I didn't miss anyone, did I? Sure anyone was here. Okay, perfect. Awesome. So I want to just send a huge thank you to all of our presenters. I know that takes a little additional time and prep and maybe some nerves, but you did great, and we super appreciate you, and just really appreciate the information you shared, as well as the work that you do for our community. So thank you so much. Next, I will open it up to if anyone has anything that they want to share, any events, any questions that they have from any of the presenters, or anything else related to the CSN. Feel free to unmute yourself and share away or ask away.
Hello. This is Georgianne from Providence ElderPlace. I just want to let people know that Providence ElderPlace is they're doing a fall prevention this Thursday from 1 to 3 at the Portland Covenant Church on MLK, and I'll also attach that to, I'll put the information in the chat, and it's free to the public. So please attend. It's great information. As you know, every 11 minutes, an older person falls. So this is some really good tools for people. I'm going to take the class too. So
awesome. I love it. Thank you, Georgianne, very much.
Thank you.
And it looks like Judy put the vaccine clinic in there. Great, super excited that you all are providing that. It is a struggle right now to get vaccine opportunities readily available. So thank you for doing that. Let's see, any other questions in the chat or anything to share? Okay. Anyone else want to share anything? I have a few CSN things to share, but don't want to take over if you. Oh, Georgianne, it looks like Divine would love your contact information. I think, Divine, if you can scroll up, it should be in previous notes, but I'm not sure how Zoom's doing that now. I don't like it when they make only the notes available for when you jumped on. But okay, did anyone else have anything to share?
I
Okay,
have one.
yep, go for it, Sherlyn.
Judy Riley. So I just want to share that you guys worked with volunteer on this amazing resource called Finding Free Food. Do you want to talk about that? Maybe share the link in the chat for those who are doing direct service with clients. Because I thought it was a really great video putting together where people can find free food.
Sure. Thank you, Sherilyn. I'm going to count on reference to do that while I'm talking. So as Sherilyn mentioned, we had a fantastic volunteer, Nancy Burrows, who put together a video. It is in English currently, and we are working to have it in other languages, but essentially outlines many of the resources that folks can do to find food in their area. So includes talking about the Oregon, food banks, Food Finder, along with other community groups, one of them being Sherilyn's, Milk Crate Kitchen, about signing up for free food resources. So we try to highlight some of the resources that people may not hear about as often or may not know about, of course, in addition to our own. So we would be happy for you to share that video, and we can certainly also send it to Annie. So we'll probably share our whole YouTube channel because it has all the videos that we have mentioned. And we have the videos not only in English, but also in Chinese, Mandarin, and Spanish as well. And like I said, the food security right now is currently in English, but we're working on getting that translated also. And I think Riley very kindly has put that in the chat. So at your convenience, definitely feel free to check it out.
Perfect. That's awesome. Thank you so much, Judy and Riley and Sherilyn. Definitely an important one to watch. I didn't know about this one, so that's great. So I'll definitely, just for those of you who maybe this is your first meeting, first off, welcome. And also just wanted to let you know that on Thursdays, I compile all of this information plus all of the resources sent to me by community to put in our newsletter that goes out Friday mornings, usually by 8, hopefully, if I can get it all done. It's information that is shared at this meeting, and then information that folks send to me all week long regarding resources available to community and upcoming events. So just so you know that that's where this information will be housed. All right. And then last but not least, just a reminder that the Nonprofit Connect is coming up on October 25th from 12 to 4. 12 to 1 is a networking event. And then 1 to 4 is tabling. You can sign up as a table host, or you can sign up as a guest. A table host is there from essentially 1 to 4, and a guest can come, at their leisure. So just know that that's coming. Ruth also has a lot of fairs coming up, some of which are closed for registration. If you go to register and you don't see the specific fair you're looking for, it probably means that we just haven't posted that it's closed, but it's closed because of space. So make sure you sign up early if there's fairs that you want to get in on. And sometimes we do have cancellations, so feel free to message us if you aren't able to sign up, but you really want to be on that kind of wait list. And the training this week for biases and microaggressions was awesome. If you missed it, we would love to invite you to future ones. So please make sure to check our website for any of those future trainings coming up that are free to you and done in partnership with YWCA, their social justice program. So I think that's all that I have. Thank you again to all of our lovely presenters and to all of you for the work that you do. I hope you have a great rest of your Tuesday, and I look forward to seeing you soon.
Thank you so much, Annie.
Have a great day. Thank you.
You too.
Thanks, Annie.
Thank you.
Thanks, Ruth.